As a specialist, most of my inspiration comes from my patients, because you'll be talking to them, you're giving them the options, giving them the information, and they sit back and say, well, that sounds silly, why can't you just do X? And so when someone says something like that to me, I write it down and I think this is what the patient wants and this is really what's going to try and improve their life. And we then get together with my research team, we talk about it and try and come up with a good research approach to address that particular suggestion from the patient. I think most people don't know that prostate cancer is the most commonly diagnosed cancer in men, and it's almost the highest killer of men over 70. Most of my research relates to improving the diagnosis of prostate cancer, but really also trying to better characterise the prostate cancer. And that's because there are some low-grade prostate cancers that don't need treatment and men might die with it, but we're really trying to find those cancers that men might die of. And so those aggressive cancers, they're the ones that we're really trying to better determine through imaging and other tests as to how best we can then treat those men so that they can have the best cancer outcome but also limit their side effects. And we're looking at this with early studies but also all the way through to clinical trials. So really the ultimate goal of my research is to find the perfect diagnostic test for prostate cancer, which really could be something as simple as a urine test that might be a dipstick, or a chemical test that could be done in a GP practice. But then once we have that perfect diagnosis, could we have a perfect prognosis, which we would do through a man scan, where it would find where the cancer is and how aggressive it might be, so then each man can have their cancer treatment personalised for the best outcome for them. Really what we need to do is understand the biology better and work out the best time to treat these people so that they get the best cancer outcome but also have the best side effect profile and essentially the trifecta of it all.